Welcome, welcome, welcome. Listen, my name is Dr. Casual Pitts. I am the VP of Sales and Marketing. And today you were invited by somebody that wants you to hear this amazing revolutionary information about KonnectMD. However, before we get started, I want to play something because I believe that it holds value to what we are about to get ready to introduce to you. And I want you to understand where we're at with healthcare. Watch this clip.
All night. I'm going to ask you a question. All right. Raise your hand if you think that the American healthcare system is working. Raise your hand if you think the American healthcare system is not working. All right, let me rephrase the question. Raise your hand if you think the American healthcare system is working well. And how many people are raising their hands?
None.
Raise your hand if you think the American healthcare system is broken. Raise your hand.
Majority, everyone.
Not a majority, virtually everybody in the room.
And I can see behind that guy. But.
And that is, all right, question again. How many nations, wealthy nations in the world, do not guarantee health care to all people as a human right? Anybody know the answer? Which country? All right. Now, you're not going to hear much about that on corporate television. You're not going to hear much about that in the United States Congress. We're the only major country on earth that doesn't guarantee health care to all people. 85 million of us are uninsured or underinsured. 60,000 die each year because we can't get to a doctor on time. That's the bad news. You know what the good news is? The insurance companies are making tens of billions of dollars every year denying you coverage. The drug companies charge us the highest prices in the world for prescription drugs. So how does it happen that in the wealthiest country in the history of the world, we're spending twice as much per capita as the people in other countries, and yet we have one of the worst outcomes, healthcare outcomes, of any country on earth? And it gets back to money in politics and the domination of big money, in this case insurance companies, drug companies, over the Republican and Democratic.
I want to try to get some more of our audience questions. Joel,
no, I know you do, but I want to talk about...
I know.
No, I want to, sometimes these issues about healthcare, about income and wealth inequality are not talked about in the corporate media, and it's time that we did talk about them. That's why the question a moment ago, why are people losing faith in the American system? We don't talk about it on CNN. We don't talk about it in Congress. It's because they understand that a handful of billionaires exert enormous influence, and that has got to change. So when I'm running around the country with Alexandria and other people, what we are trying to do is demand that working class people begin to stand up and fight for their rights. There is no reason we should be the only major country not to have health care, not to have paid family and medical leave, et cetera, et cetera. Why we have the highest rate of childhood poverty, almost any major country. 22% of our seniors living on $15,000 a year. Anybody here think that makes sense? No. All right, it doesn't. But you got to get CNN to talk about these issues. You got to get your members of Congress to talk about these issues.
Guys, listen, this is the reason why KonnectMD exists. KonnectMD is a healthcare membership that's not insurance. It provides 24/7 access to physicians, free prescriptions, and you can add up to 7 family members on the plan for no additional cost. Our silver plan is only $60 a month. That's going to give you everything that I just mentioned, plus dental, vision, and chiropractic. Our gold plan is only $80 a month. That's going to give you everything in the silver, plus free mental health and access to 12 additional specialists. Our platinum plan is only $100 a month, and that's going to give you everything in the gold and in the silver. And what's added here is access to a primary care physician. You're able to receive a free dermatologist and 2 blood tests that's administered through Quest Diagnostics and LabCorp. Full disclaimer, this is 100% telehealth. However, there are 5 services that do require brick and mortar. That is going to be your dental, your vision, your chiropractic, your blood work, and if you choose to see a mental health therapist in person, you have the option to do so. The benefits of having our membership is there's no Social Security to enroll into our program. There's no waiting periods because this is not insurance, which means that when a member enrolls today, they can use the service today. And most importantly, no previous medical history will get you denied for this program. So that is the amazing service that we provide with KonnectMD to help families in all 50 states. So what I'm going to do is I'm going to take the top 10 questions of our program. so you guys can actually understand who we are and what we do. So the first question is, so can I go to the ER or urgent care with this service? The answer is absolutely no. Again, guys, this is 100% telehealth, right? Anything that's catastrophic, I want you to understand that we are not advocating to replace insurance. We are a benefit for it, right? However, anything that has to go to a brick and mortar, that's where your insurance will kick in, okay? KonnectMD is 100% telehealth. Next question. Can you explain how this benefits people who already have insurance? Great question. We covered 3 sectors of the insurance model. Your first sector is going to be individuals who already have insurance, right? The 3 disadvantages: they cannot see a primary care 24/7. They're not going to have access to free prescriptions because there's a copay and a deductible that's administered. And they are not going to be able to add up to 7 people on their insurance plan without the cost going sky high. So adding KonnectMD as a membership benefit to any insurance plan, there's no cross-reference. There's nothing that's going to mess up the insurance because it is a membership. When you think of us, think of Costco or Sam's Club, right? That's exactly what this does. But now it meets the demand of those 3 disadvantages that your insurance carries. Your second group of people are going to be your people who receive free health care, Medicare, Medicaid, veterans, and your Indian tribes. Where this benefits them is because in that sector, it is almost a 45 to 60-day waiting period to even get an appointment with their primary care physician. So for KonnectMD to be added to those individuals, we're providing accessibility and convenience, right? And then your third group of people are going to be your individuals who absolutely have nothing at all. Your entrepreneurs, your real estate agents. This becomes a primary for those individuals, okay? Next question. What are the ages to add people to the plan? You have up to 7 people plus you. Ages 25 and under can be added to any plan. Anybody that's 26 and over does have to have their own membership. Do the physicians write prescriptions for narcotics? Absolutely not. No telehealth company service physicians will write for narcotics. And I think that we understand and know the reason behind that. Is the dental, vision, or chiropractic virtual as well? Because I am confused. No problem. Allow me to unconfuse you. Again, the services that are required for brick and mortar are your dental, your vision, your chiropractic, your blood work, and if you need to see a mental health therapist, you have the opportunity to do so. Is there anything I have to pay outside of having my membership? Absolutely not. No copays, no deductibles. The Platinum is cheap for all that it offers. Do you guys plan on raising the prices because this is amazing? Well, number one, thank you for validating the value of this particular program. And no, what you see here is what you get. If we were to do anything, it would be adding an additional membership. It took me 2 minutes to enroll, and I saw something about virtual pet care. So are there prescriptions covered as well? No. We do have add-on services, and the virtual pet care is one of those services. And I will be going over the add-ons to showcase to you guys what's offered. But their prescriptions that are, first of all, the veterinarians don't write for prescriptions. But if you do go and receive a prescription, you do have a pet prescription card that gives you up to 80% off. Okay. Next question. Can you explain the message of specialist feature? Absolutely. So starting at the gold plan, you have access to 12 additional specialists that you will be able to message in regards to things like sports medicine, a allergist. You will have access to that. And I'm going to do one even better, is I'm going to actually show you guys what a portal actually looks like when a member enrolls into our program. Last question. Why would I keep my insurance? Because this seems better. Well, thank you for the value of that. Guys, again, we're not advocating for people to drop their insurance, right? That's not what this is. However, we understand the cost of healthcare currently right now. And that would be a decision that you would have to sit down with yourself and your family and figure out if that's something that you want to do, right? Because we understand the importance of having insurance. It's just that we can't afford it because insurance will take care of the catastrophic side, right? So there may be solutions like private healthcare insurance that could be somewhat affordable, right? Removing all of the the non-chronic things to that healthcare plan, which gives you a very lucrative amount to pay, and then adding KonnectMD in to take care of all of the non-chronic things. And you should be able to be in a position to afford a full package, right? But that would be something that you would have to make the decision on your own, okay? So now the add-ons. These are amazing, guys. So our first add-on is the virtual pet. And as you can see, what it's going to do is only $19 a month, and that's unlimited pets. But it's going to give you advice, opinions, and recommendations, emergency suggestions. When it comes to behavioral problems, you may have, the pet may have skin conditions, lumps, bumps, and things of that nature. This is where that virtual pet care will come in, because guys, it costs just to go get these particular things done. They're going to charge you, right? Our medical bill advocator, which reduces medical debt and in some cases removes it completely. So that's only $29.99 a month as an add-on. And then your VIP booking engine. We have our own travel engine that will give you discounts on hotels, cheaper than Expedia, cheaper than Priceline. And if you happen to find a hotel that costs more, we'll pay you the difference up to 110%. And by having the VIP booking engine, we're going to give you 100 room coins month after month, as long as you have the VIP booking engine that goes towards the savings on your hotel room. Plus, you get 10% back on cruises, and you get cash back from local places that you shop at, right? So the VIP booking engine is definitely a travel discount program. And then we have the GLP-1 weight loss. For those that like to do the semaglutide, we have that package for them, $375 a month, and that's going to come with all the medications included, your doctor to write that prescription and also assess you, your blood work, and it's going to give you a dietitian to help you stay on track. And then our last add-on is our Active SOS, similar to Live 365. The difference is with this particular program, we do not sell our members' information. Very, very powerful. That's $129 a year. Now, here's the thing. You may say, Dr. Pitts, well, I don't want any of the memberships, but I do want one of the add-ons. Can I take one of the add-ons by itself? And the answer is yes, you absolutely can, right? If for some reason you don't see the value in any of the healthcare membership services, you do see the value in one of the add-ons, then you absolutely can take one of the add-ons as a standalone, okay? So last but not least, guys, I'm going to now give you a walkthrough into what a portal looks like. So when a member enrolls, this is what they're going to receive. They're going to activate their account. Once they sign in, you guys are now looking at what a platinum portal looks like, right? So you got urgent care, primary care, dermatology, psychology, psychiatrists, behavioral health, right? So let's just say in a situation where it's 8 o'clock at night, you're going through some symptoms such as sinuses, all you're going to do is log into your portal. And for those that are technically challenged, don't worry. We have an 877 number down here that you can call and do the same thing that I'm doing via portal. Click on urgent care, click on your name. Then what I love about our program is where you go, your membership goes, okay? So for this illustration, we'll keep it at Georgia. You can select phone or video, hit next, put in your symptoms, hit next, and then add additional symptoms to help the physician understand your situation better, right? Hit next. Then, of course, this is regular, right? Within 2 hours, once you hit next, you're going to hit English or Spanish, depending on your language. Do you require any prescription refills? Do you have any medications or allergies? Verify any update medications. Do you have any medical conditions? Do you have any surgeries to report? Verify your height and your weight. Select your pharmacy based on the zip code that you're residing during the time that you're using the service. Just make sure your number is correct. Hit your 3 terms and conditions. Do a quick survey. What would you have done if you didn't have the service? Hit save and finish. As soon as you hit save and finish, you're going to receive a text message and an email. And guys, within 8 to 10 minutes, you're going to receive that phone call from that particular physician that will assess the situation, go over a holistic plan if needed. And if it's something more severe, then they'll go ahead and write that prescription and send it to that nearest pharmacy that you selected in that particular drop down area. And that's pretty much how the services work for pretty much all of the programs here, guys. Really quickly, when we talked about the message of specialists, here are the 12 additional specialists, right? So for an example, if you had a knee issue and from a sports injury, you would click on sports medicine. You can just type in what issue you have, right? And then you can upload any pictures that you need to upload. Once you upload that, you can message that specialist, and within 2 hours, no more than 24 hours, you're going to receive a message back from a specialist assessing the situation and walking you through what the next steps are. And that's pretty much what you would do in this particular area. Very, very powerful, because to go see a primary care in person that may refer you to a sports medicine, that may refer you back to the primary, guys, that's just too much, right? When you can handle all of that in the comfort of your portal, at the comfort of your own home. Okay, so that's the message of specialist feature. And then, of course, when you hover over my benefits, your dental, your vision, and your chiropractic all works the same. When you put in your zip code and hit search, it is going to pull up a list of providers in your zip coded area. So as it's thinking, it's going to pull up those providers. Give it time. Give it time. It's coming. It's coming. There we go. There's all the providers here. Once you find that provider, you're going to then come back to your portal and follow steps 2 through 5. Okay. In this illustration, a dental cleaning typically costs about $130. Because you have KonnectMD, you would pay $69. And that is the benefit of having KonnectMD, guys. I just want to thank you for your time. Get back with the individual that invited you to listen to this amazing information and select which plan that fits you and your family. If I could leave you with one thing, I'm going to leave you with this. Coming together is the beginning, sticking together is progress, but working together is success. My name is Dr. Casual Pitts, and I'm your VP of Sales and Marketing for the amazing KonnectMD, and I look forward to servicing you and your family. Thank you.
Scan the QR code or text HEALTH to 833-203-0805 to get started.